The Meros Center is a joint venture between Kingdom Workers and Wisconsin Lutheran College. And we have a partnership with the University of Zambia School of Health Sciences. And the objectives of our partnership is to build the evidence base of the community health ministry in rural and urban areas of Zambia, but also to equip health science students with the knowledge and skills to design, conduct, as well as analyze research that is relevant to improving health in Zambia. So you can see that objective number 2 of this joint venture is exactly what we are doing. And thirdly, we want to contribute to the development of the Faith and Health Research Network, which is a sustainable research center allowing for cross-cultural collaborations with faculty, both from Meros Center as well as the University of Zambia School of Health Sciences. So technically, this is what the joint venture is about. And before I waste so much of the time, please allow me to welcome our first presenter, Jennifer, and she's going to introduce herself and begin the presentation. Thank you so much, everyone. Jennifer, please, over to you.
All right, thank you, Brian. And I am really excited to be with you, even if it is virtually. And I appreciate Dr. Chiluba asking me to present on a topic that I'm actually very excited about and means a lot to me personally, about qualitative research and how to analyze that data. And so my background, I have a PhD in nursing. I spent 27 years as a nurse in the U.S. Air Force. Primarily working on community health and chronic disease prevention and management, but then later into research once I got my degree in 2009. I just retired from the Air Force, and so the Meros Center is sort of the beginning of my next career, and I'm excited to partner with the Meros Center, and I'm happy to answer questions about that later at the end. But also especially excited to be able to collaborate with the University of Zambia and other partners around the world. It's kind of a neat opportunity to be able to do that and pursue those opportunities outside of sort of the traditional way that we do things, which is a little bit more in a silo or in like a tunnel where we don't get to meet other people or interact as much. So it's a great opportunity. So let me share my presentation with you, and there we go. All right, Brian, does it look good on your side?
Okay, so it looks good.
Okay, good. I just want to check. Sometimes what looks good on my side doesn't look so great on the other side. So thank you. All right, so really the focus of the lecture or the presentation today is being very practical. And I am a very practical person. While I appreciate the ideals and the theoretical approaches and the structure, I also, as a nurse especially, recognize the importance of being able to do things in the real world where things are messy and not always as you expect them. So just wanted to be able to talk through that with you today and share some of what I've learned along the way, and also answer any questions or maybe talk about any challenges you might be having or have seen and how you might navigate through those. So just a little bit about my research background. So I did my PhD at Johns Hopkins and I looked at health disparities. And I used a very large data set, about 300,000 people, looking at the prevalence and the control of some chronic diseases. And so very quantitative approach, which was great. The tricky part is I got an answer and I found different prevalence rates by different races and different genders. and different socioeconomic status, but it didn't tell me why. It didn't tell me any of the background. It only told me that there was a difference and that some groups were higher than others. And so that sort of pushed me to do a qualitative study next, to really understand the why that might be. And that's pretty common, that qualitative helps explain why. Sometimes it's flipped, sometimes qualitative studies help design a quantitative study, and we'll talk about that a little bit later. But in my experience, it was really to understand the results of the larger study. And then following that, I don't want to say I fell in love, but I I began to see not only the value of it, but the richness of qualitative research. And so several other studies that I was part of, looking at stress among nurses and how we manage pain during air medical transport. So those are, that's how I began getting involved in qualitative study, and why I think it matters with that. So for this presentation, the goal, or my goal, is to give a quick overview of qualitative research principles. I think it's helpful to kind of reframe or reset. You might have been thinking about something completely different, last hour. So we'll just get in the right mindset. Then we'll do a short coding activity together. It's intended to be something we can work on individually, but we'll see how easy it is to get comments or input. And then I'll talk through a little bit of a practical approach to that data analysis stage with that using spreadsheets. And then there'll be time for questions at the end. And I'm happy to either answer any question about the presentation or other questions about qualitative research, or we can do a little bit more demonstration of the analysis stage. So just an overview here. Let me move my, doesn't work. So it's really with qualitative to understand experiences, perception, behavior, really that why, and sometimes the how, but it doesn't quantify, it doesn't count things, it doesn't tell you how much. And you may get a comment, but you don't know if everybody feels that way or if just one person does. But that doesn't matter, because we're just wanting to understand the why. And sometimes it's multiple reasons why. But the strength is that it can really help us understand processes, patterns, or human behavior that are hard to measure. And so sometimes we want to understand, how did things happen over time? And that's hard to measure, because you can't interview or send someone a survey and have them fill it out every single day or every single hour. But you could sit down with them after the fact and have them describe how that happened, either during the day or over the year or whatever that might be. And so that's one reason why qualitative is so helpful. It is distinctly different. It's just a different way of having your brain think about a question and how to answer it. And sometimes it's surprising when you're trying to switch between the two, that your brain defaults to one without realizing it. So you have to be thoughtful about it. But it's not the opposite. And it's not that qualitative and quantitative can't be done together or can't be merged in some ways appropriately. So those are some things that are important to remember about those two different research families, if you will. I would refer you to this. I have a link there at the bottom of the slide, just a really nice overview of qualitative research. If you're new to it or trying to get a quick refresher on that, just kind of walks through some of the key steps of that. So there are many types of qualitative research. These are 4 common ones that are each unique in their own way. So ethnography comes from more of the anthropology, where you immerse yourself in a setting and you pay attention to not just what people say, but how they act, what they use, the furniture, the surroundings, the literature that they read, the signs that they see, all of those things, and that all together informs your findings of whatever that study is. Grounded theory is when you definitely want to develop a theory. You're not sure how something happens in general, and you want to understand it better and come up with a model that helps you design or helps you describe how that phenomenon happens. So again, the purpose is to develop that theory. That's what makes it different than the narrative research. But you've got a design in mind, or a plan in mind to develop a theory, and you want to be able to make that happen. The third one is phenomenology. So that's where you want to understand an event or some sort of experience. And the way that you want to understand that is through the eyes of the person experiencing it. So you don't want to understand it from the experience of the family or the caregiver or the clinician. You just want to know it from that person. And so it's almost like you're sitting down and looking through their eyes to see how that is. And that's how you would describe it. So that's somewhat unique for phenomenology. And then lastly is the narrative research. So you want to understand something. And this is most common. It's, I would say, easiest, but that's not really true because it's not easy. But you're really wanting to describe something or describe a phenomenon or understand something better. You're not doing a theory. You're going to ask a bunch of different people, perhaps, to better understand something. And that's more of the narrative research. Okay. Sampling and data collection is definitely different also with qualitative research. It's usually homogeneous, which means everyone's pretty similar to each other or has a common, you're not trying to get random. You're not trying to understand the whole population or the whole world. You're wanting to understand a small group of people or a very narrowly defined objective. So for example, you might want to understand one idea we've talked about when we were in Zambia was talking with people about their experience recovering from stroke. And so you might want to say, I want to understand that from the person that had the stroke and their family. What was their recovery process look? What did it look like over the first year? And so that's pretty narrow where we want to just look at that group, but it helps you understand that topic a little bit better. There's a really nice article that I just discovered that talks about how many interviews or focus groups till you reach saturation. Sample size with qualitative research, they usually say, we'll continue collecting data till we reach saturation, which means we haven't heard anything new or unique in the data that we've collected. It's a little controversial because some people say, well, everybody has a unique story. So you could interview everyone in the world and everyone's got a unique story. But at the same time, some people get bored. And so they say, I'm done. I've reached saturation. So it's sort of in the eyes of the brain of the data collector about whether they've reached saturation. But I think it's helpful to just be deliberate about how many, not a priori a number, but to really be thoughtful about, you know what, I'm starting to hear the same themes and I'm not hearing big differences in those things. And so this group here that published this article said that they found it was about 9 to 17 interviews, so individual people, or if they were focus groups, about 4 to 8 groups that were described as reaching saturation. And so that's probably a good, from my experience, that's similar to be able to say it's about that many. You don't want to do 100 for sure, and you don't want to do 1 or 2. You could if there's a reason, but this seems like a nice representative range of how many people, participants or sample size with that. I mentioned interviews and focus groups. So interviews are usually just one-on-one. It's especially helpful for sensitive topics or something more in depth. To be honest, I've also found it very helpful when there's busy people. And so it's hard to get a group together. And so you might just say, we're just going to do interviews. And that way I only need to schedule with one person and worry about their schedule one at a time. So that might be another practical reason to do that. And with interviews, you can either do the same questions for everyone, sort of structured or unstructured, which means you ask one opening question and then you just follow their lead down the line. I've found that the structured questions are helpful, although sometimes it's awkward because they've already answered a question, but it might be a chance to either confirm or explore a little bit more on that topic if when you get to that question, in your interview guide. But there's benefits to both. Focus groups are usually 8 to 12 people. Partly the reason for that is the focus group is not only the answers that you get, but the discussion between the participants. And also sometimes those participants will say something that reminds someone of another topic. And so it's good to kind of see that back and forth. It's another way of getting input in a way that's not just a question from the interviewer. And then lastly, it's not a controlled setting where you collect the data, although usually you want it quiet and private, but it's usually in their environment. So you go to them and ask them questions about your topic versus coming to a clinical setting that's outside of their community. All right, the other thing I wanted to talk about was the rigor. So in quantitative research, we talk about reliability and validity a lot. We want to know, are your results reliable? Are they valid? Did you measure what you said you were going to measure? If we were to collect that data again, would it be similar, or would we get that same result? And similarly, in qualitative studies, it's that same idea. Can I trust it? Can I trust your results? And so these are the words that normally are associated with qualitative. And in that overview article that I mentioned at the beginning, they talk about credibility. It's essentially a similar concept to internal validity. So how credible is your research team and your design? A lot about that is internal validity. Transferability, so does this transfer to other people? And sometimes that's how you collect your data, or who you talk to, or how you designed your study, is that external validity. And then dependability is a little bit more, can we depend on how you doing the study the right way, that you've been honest with the results, so that handled the transcripts appropriately. Basically, can we depend on you as a study team? And lastly, confirmability. So did you just come up with things on your own and say, this is what they said? Or did you go back and double check and confirm that, no, that's what they said? Or did the participants say that that's how it worked? Or how did you make sure that what you inferred from their information is actually what they meant? Because sometimes there can be miscommunication with things, and so that confirmability is important to at least think about and to be able to address. All right, the data analysis piece. There are several different ways of doing data analysis, and they're all listed, or 5 of them are most common are listed. They're very similar. Sometimes it seems silly that we're sort of labeling things different, at least in my opinion. But they each have their own, I would say, unique steps or unique focus. For example, grounded theory. If you're doing a theory development for your qualitative study, you definitely would want to make sure that you end up with a theory. And so that grounded theory method kind of walks you through those steps, whereas thematic analysis may not help you walk through those steps as deliberately, even though there are some common steps in between. But I wanted to focus on thematic analysis. It's the most common one. People talk about how it's good for beginners, I think. I don't know that I would agree with that. It's not harder or easier than the other, but it's just a nice common framework that most of the others seem to follow. And so that starts with just understanding your data, getting familiar with it. Then you generate codes, and we'll do a quick practice with that. And then you take those codes and you kind of see, do any of them lump together into a theme? And that's helpful because there's different parts to it, and it's not like you're scattered, just dots everywhere on a page, but there's usually some dots that pull together, and then you start to see a little bit more of a pattern or a design with things. Then you review those themes, make sure that all makes sense. That's when you can define them and sort of say, this is what that theme means, and then writing it up. And I would refer you to this really helpful book by Braun and Clark. They're sort of the experts with thematic analysis, and they just recently published a book that's helpful. The original one was from 2006, I think, which I found very helpful. I imagine the 2021 would be good, but whatever version you find, very helpful to walk through that. All right, so let's start with practice. And maybe before I do that, are there any questions or any comments that you have about qualitative research in general? Okay, I'll keep pressing forward, and if you did have a question and I didn't catch it, we'll get it at the end. So here's the practice. I have actually two interview quotes that I was able to find. This first one is from a book written by Tim Keller, who is a pastor of a church. He recently passed away. But this is just a short paragraph of him describing his experience prior to surgery that he had. And so what I'd like to do is I'll read it, but I'd like you to think about maybe 2 or 3 sections of this text that you think would be a code and how you would code it. What would be the code you would label it? With that, I've got some that I identified. This would be a perfect time for us to discuss it if we were part of the same study team. But we'll start with just initial codes as if you were coding it for the first time and then I were coding it for the first time, and then we sit back together and compare. But this is, again, his words, 2 or 3 codes. So you'll find like a phrase or a sentence that you think is an important point, and what would that code be? So on the morning of my surgery, after I said my goodbyes to my wife and sons, I was wheeled into a room to be prepped. And in the moments before they gave me the anesthetic, I prayed. To my surprise, I got a sudden, clear, new perspective on everything. It seemed to me the universe was an enormous realm of joy, mirth, and high beauty, and within this great globe of glory was only one little speck of darkness, our world, where there was temporarily pain and suffering. But it was only one speck, and soon that speck would fade away, and everything would be light. And I thought, it doesn't really matter how the surgery goes. Everything will be all right. Me, my wife, my children, my church will all be all right. I went to sleep with a bright peace on my heart. So, again, maybe I'll give you about 2 minutes. If you want to write down, and you don't have to write the whole phrase, but write down 2 or 3 phrases with what code that would be. All right, I'm watching my clock, maybe like about 10 more seconds. Okay. So what I have done on this next slide is I highlighted what I thought were important phrases. And then I sort of categorized them into color. And on the next slide, we'll talk about what I labeled them. And again, it's the first time you do it's a little tricky, so it's helpful to do it with someone and kind of compare notes afterwards so that you get on the same page. But you start to say, what are the key comments that this person made about their experience? And so it seemed like they were talking about their family. It seemed like he was talking about his faith or praying. Seemed like he was talking a little bit about getting a new perspective or a new view of how things were. He did talk about suffering or pain. And then the light blue one, that last comment, went to sleep with a bright peace in my heart, seemed important, and it seemed like there was another section that was similar or related to it. So those were the ones that I picked out. Again, we might have a conversation about, you find something different or you might disagree, and that's wonderful, because that's an important part of the coding process, especially when you get together with your study team and say, I didn't see that, or I saw something else, or in some cases, you know, we were viewing it from a different perspective, and so then we say, how do we want to best capture that and pull that together? Often that happens after the first, you know, more than one, because then you get a better perspective together. But sometimes it's good to do it after the first one as well, just so that we're starting to get on the same page. So I pulled out all those phrases that I highlighted in the different colors and categorized them. And so those yellow ones I said were related to family. The purple one about praying, I labeled faith, sort of expecting perhaps other people might talk about other topics that were not necessarily prayer, but maybe faith. But again, that might change over time. Hope seemed to be the other one, where he's describing everything will be okay. Suffering there, and then peace for the final one, especially looking at that second quote there. I do like to, and it's important to use the words that people have used as they describe something. However, sometimes there's a bigger idea that you can perceive from that. But again, that's something that between you and your study team can talk through. But it's always good to default to first a word that they've used, unless there's a reason not to. But sometimes that's part of the art of doing coding. All right, so we'll do a second one. Now, remember, we've got those 5 existing codes already from our first interview. This is a second interview with a clinical psychologist who had a similar but different experience. This was not his surgery, this was his wife's surgery, and then describing what happened afterwards. So similarly, if you want to pick, I'll give you 2 minutes to pick maybe 2 or 3 key phrases. And again, thinking about those existing codes is sometimes helpful to say, I saw that before, and I think that phrase belongs with this similar code with that. Sometimes you'll find something new, which is also exciting. You know, we haven't reached saturation yet, definitely, with only 2 interviews. So we'll talk about that. So let me read it. Again, getting familiar with our data. We went to see the doctor after my wife had had her surgery and found she had contracted this cancer. And that was just the beginning of, endless nights sleeping on the floor in emergency and continual surgical complications. And then, my mood was wavering at that point, and I was taking a bit more of a benzodiazepine, but I started to react to it in a paradoxical manner. It seemed to be making me more anxious rather than less, and I tried various means of dealing with that, but it just got worse and worse. All right, I'll give you 2 minutes to think of a couple of codes there. Okay. Does anyone want to share if they found a code that matched one of the others that we had found already? All right, I'll just go ahead. I'll keep pressing.
Jennifer,
And
we
we
had a
can,
few responses in the chat.
Oh,
I'm
I'm glad you mentioned that. Okay, good. Suffering, that's good. Endless nights and mood swings. Thanks, Rod. I appreciate you calling my name or my attention to that. More anxious rather than less. Good. And suffering in the family. Yep, for sure. All right. Awesome. So you can see how that you can start to see some common themes. And how about what did anyone see with differences, like a new idea or a new code? Self-centeredness, that's a good one. Mood swings, yeah. All right, that's probably a good place to be. So let me go on to the next slide where I've got my highlights. Let's see. There we go. So similar family identified with that one. Suffering, which was mentioned also, and I didn't see the word as much as the idea or kind of describing it. That mood swings was I put under hope, but again, that might be something we would talk about. And then similarly, he seemed to be making me more anxious. So he was getting anxious. I put that under the category of peace, which I thought was sort of the opposite example of it. But again, something we could talk about. The other thing that I found that was different in this case is he was using medications to manage his mood swings or anxiety or concerns with that. And so that was kind of a new idea with that. So let me show you. This is traditionally how things get put together. And I'd say more in a manual way, like doing it manually, where you pull these things together, where it's the gray box, that those are quotes from interview 2, and where it's white is interview 1. And again, we might go back and relook at that and change some of these around, which is important to do as a study team. So that little bit of a process, sort of a very short activity, highlights some challenges. It's hard to do coding in the same document with multiple team members, but yet you want multiple team members to get the different perspectives. And because when you're on the same page, you say that must be right. And when you're different, you say, what is it that's different, and how can we describe it in a way that says, yes, we both see it that way? Or how do we, sometimes you say, I see where you're coming from. Yep, I agree. And sometimes vice versa. The other tricky part, especially if you think about that table before, is how could you go back to that quote again later? You might be able to search for, the text, but trying to keep track of everything is a little difficult with that. And then how would you share those codes and ideas between team members? So you could put those tables together, but as you get to themes, how are we pulling them all together? And so it gets a little bit cumbersome with that. And if we decide to move from one to another, how do we update that? How do we adjust those? And then how do we document those changes? So there's a lot of things that are happening in that data analysis stage that are difficult to go through. There are a few computer programs. NVivo is one that I'm familiar with. That was one that I was taught how to use in my PhD program. And it is designed for qualitative research data analysis. And so it's very intuitive, very nice to use. I think there's another called Atlas TI that can be used, and I imagine it's similar with that. The challenge, in order to share it with somebody else, your other team member needs to have that too. And it's a little expensive, to be honest, to purchase that software. If you have it freely available, then I would recommend it. But if not, I would like to present another solution, which is just using a spreadsheet in Excel or Google Sheets or whatever that you've got. And I'll walk through how that would look. And so each quote would stand alone in a single row. And so in your row, and I've got an example here, your columns will show which transcript, which helps you know where to find that quote. It's going to have a couple of demographic or setting details. So for example, if you did several focus groups, some in a rural setting, some in urban setting, you might say, this transcript came, or this quote came from a setting that was in a rural area or in an urban area. And so you keep a column for that. And maybe there's some other details that you're curious about or are important to you. For example, in our stroke discussion about, understanding the stroke recovery process, you might say, this interview was with a stroke, or this comment came from the person recovering from the stroke or who had the stroke. This comment is coming from family members, because I can imagine those would be different perspectives. And I'd want to understand both together, but I'd also want to be able to separate both. So those columns can be helpful. And then you'll also put the line number of the quote. And so if you noticed from when we did the practice, there were numbers listed to the left-hand side. Now that's easy to do, put on with Word. There might be another way to do it with Google Docs. I wasn't able to find it, so I had to go over to Word to put my line numbers in. But having those line numbers is really important to be able to say, this is exactly where that quote came from in the transcript. And then you'll enter in the code. And then once you've done that, then you'll identify your themes, thinking about that thematic analysis process. And then there's another, I would recommend having another column for any notes or comments. So similar, we might talk about our mood swing. Should it be mood swings, or should it be hope, I think is what I did. And so those might be some things that we want to talk about a little bit more, or we don't have harmony yet. And so we'll need to talk through that. And that column can help us talk about that. The nice thing about using a spreadsheet is you can share it with team members very easily. Just remember that sometimes being able to share easily is a danger, especially if you've got human subject protection concerns. If you've said, we won't share these transcripts with anyone, and as you start to code, those become similar to the transcript itself. So you'll have to be careful and just share it with the people that you're supposed to be sharing it with, and make sure that you're sharing it to through a platform, like not sending to a personal email at home, but sending to a professional email or those types of things. Just make sure that you're careful about that, because it's so easy. It also allows for comparing quotes within a single code, and I'll show you how to do that. And then you can also do a nice job of summarizing things, and that's an easy way to share with the community or team members or your study team. It's kind of a nice way to pull everything together. And it's easy to switch between the codes themselves or the quotes themselves and the codes and the themes. And as I mentioned, you can document with that. All right. This is what it looks like when you're putting it together. So I added the colors just so that we can mentally remember what we did before, but you don't need to put colors into the spreadsheet. But you can see that left column is which interview. So I've got the first interview and the second interview. I've got my descriptor. I thought it was important to see the difference between the pastor and a psychologist. Those are two different perspectives. It had very different things to say. There might be other things that I would talk about. Perhaps there are different settings or different things. So I may want to add an additional column, but for this example, just what their role is or what their background is was helpful. Then you can see the line number. So that first quote, I said my goodbyes to my wife and sons, that goes back to line number 1 and 2 in interview 1. So I can easily go back to it if I need to and find that. It helps with that credibility and that internal validity, which we said was something in terms of just making sure that you're doing it in a systematic and thoughtful way. Then I transferred over the codes. When I'm doing this, when I'm coding to start with using this method, I will have on the left-hand side of my screen, I'll have a transcript. On the right-hand side of my screen, I'll have the spreadsheet open, and I copy over important phrases and I paste them into that column. And then I put the code that I'm thinking about, like family, with that. And so that's the first, and then I go to the next phrase and I pull that over, paste it in, say which line number, and then I say what that code would be, and just work my way through each transcript. And so that's the step of coding within that spreadsheet. And again, I put colors, not because it needs colors, but just to remind us what we saw before when we were doing it sort of that traditional manual way with that. So then the next step is looking about those themes and also confirming codes, because the first code that comes to mind isn't always the one that you think. After you've read the next paragraph, you might say, you know what, it shouldn't have been faith, it should have been prayer, or it shouldn't have been family, maybe it should have been spouse, or whatever that might be. And an easy way to do that, so you go through each transcript line by line, put in your quotes and identify your codes. And then what I like to do is sort those codes. So I lump the codes together so I can see and then read those quotes do I still feel good about what that code name is, or that the name of that code is? So for example, those first three, the pastor was talking about his wife and sons, and then mentioned his wife, his children, his church will be all right. Is that, good? And then the psychologist talking about his wife having her surgery. Did those all feel like family? Yes, he's talking about family, and so maybe we would keep it that way. But I might have some comments or things that I want to talk about with my study team. For example, the pastor mentioned his church. Is that family, or is that a different code? And it's okay to have the same quote have two different codes if they're distinct, because you want that code to stand apart. So maybe there's another line that we add that says my church will be all right, and that code might be church or spiritual family, or whatever you decide, or you and your team decide. And then you go to the next clump of codes and you say, here's suffering, and let me see, when I look through those, do I still feel good about those three phrases? Do they really point to suffering with that? And so maybe we need to talk about pain, and maybe we need to talk about sleep or lack of sleep or sleeplessness or something like that with that. And so it's nice to be able to group those codes together. And then it's also very helpful, as those are grouped together, to start to identify themes. And so that's that next column over from code. And again, thinking ahead, I wouldn't normally put those themes in until we've done all of the transcripts. And I would hope we'd have more than 2 transcripts. But if this were all we had, this might be a way for us to talk about themes in terms of relationships, difficulties. It was interesting that the pastor talked about prayer or faith, and the psychologist talked about medications. And both of those were ways of coping with their anxiety around surgical procedures. And so you can see how that comes together. The hope and peace seem to be outcomes. Again, we might want to relook at, especially the psychologist that mentioned being anxious. Perhaps that's more anxiety. But again, thinking about that together, and this gives a nice way to be able to do that within the individual quotes. So if at the end there's questions about walking through this in Excel, I'm happy to switch over to that, and we can go through a few ideas with that. All right. Okay. So the what I have found also very helpful, and I mentioned it briefly, was sorting. So sorting by the codes, or you can group those codes together, or you can group themes together to make sure codes are all hanging together, and then you can easily see the quotes. You can also group by participant type if you just want to read through their comments or their information. The other thing that's helpful is filtering. Maybe you want to find a specific quote, or maybe you want to see all the quotes with a specific code and just make sure those work together. You can also compare specific codes by participant type. So you filter by the code and then filter by participant type, and then you only see codes that, for example, the pastor said, or only quotes that maybe stroke patients said. And that's a helpful way to be able to just feel good about being consistent with how you've coded, but then also go back and either explain things or talk about things together as a study team. But to me, that's very important. Maybe just as important. I was going to say most important, but most helpful way to do thing is the pivot table function. And that's how you would count your themes and your codes. Now, that's a little controversial to say about qualitative because we don't like counting in any ways. But it is interesting in some ways to say, are we seeing certain codes only mentioned by one group or another group? Or how many, maybe one code only has one time it was mentioned. And so I want to be able to know that so I can take a look at that. And so this is a summary of what we've coded already, and where you can see we had, 3 times family was mentioned, and sort of seems to be representative, but some of those coping ideas were different. It's easy to see when you just have maybe 10, 20 lines of text, or maybe, a total of 15 quotes that you've pulled out. But when you get to 900, that's hard to go through one by one. And so this is a really valuable way of taking a look to see what information or what key codes have you identified. This is also a really nice way to look at relationships between those themes and codes. You can also sit down together with your study team and start here and then get into the weeds, depending on how you've agreed to do that. This is also a nice way to sit down with your community members to really look at this and say, this is what we were seeing at a very high level without talking about individual quotes that people might have mentioned and feel embarrassed about, but these are just the codes and the codes and themes that we identified. And sometimes they'll say, peace doesn't make any sense. I never had any peace. And so you may want to go back and relook at that, again, based on their comments. So I do want to make just a couple of quick comments here about the data analysis results is only as good as data collected. So make sure if you're part of a study team that you've spent some good time making sure the data collection, both the interview process as well as the transcripts, are done as well as you possibly can. Because once you get to the data analysis stage, you're not going to be able to make up for any drawbacks. That's already too late. They talk about in the thematic analysis getting, familiar with your data. And to me, the best way to do that is read through each transcript in one setting before you do any coding. And it's very helpful to just start to get an understanding of what's being said. I don't know that I'd recommend reading all the transcripts in one setting or all the transcripts before you code, but at least read the one entire transcript before you start coding it. You'll get to know your process better, but making sure you get the big picture first. The other thing is sometimes it feels a little scary to assign a code, and so you pull out the quote and you're like, I don't know. I'll skip it, go to the next one because I can't think of a word. And I've found that actually takes me longer because you just go with the first word that comes to mind, or, kind of pull it together. And then as you go through the process of sorting and relooking at those codes, then you'll get to be able to adjust that. The other thing I want to mention is if you've got just one quote for a code, that's not wrong. It could be that that's only one person mentioned it once, and that's okay. It may be a unique perspective that needs to be included, but you need to look at it to make sure it doesn't belong with something else, or that it really is a unique thing, so that you feel comfortable having that. I've mentioned having a team is really helpful so that you can talk through things. The reviewing results together with participants, that's not required. It's technically called participant checking, but it does help with that credibility, both for the community that they feel like you've captured their voice, but also for your scientists to say, I've done participant checking. But again, it may be appropriate, it may not, it depends. And then lastly, stay humble. So don't think that you know up front what the answers are, and don't think that when you sit down with your study team members, you're the only one that matters. Be humble and get that input. It's really helpful. I wanted to provide this, and I'm not going to go through them individually, some criteria that are have been established for reporting qualitative research. It's a nice checklist of things at least to think about as you're starting to write up an article that presents the findings of qualitative research. it feels a little overwhelming. There's 3 pages, I think 32 questions, but really important to be able to speak to and think about. Sometimes it's even helpful to look at these things in advance as you're designing your study, so you can think about, maybe I need to add somebody that knows more about stroke if I don't have someone on that team, or maybe I need to make sure that I've got both men and women on our team, especially if it's a unique population. Those kinds of things are important to think about at the beginning, and this is a nice checklist to do that. So this first slide is about the research team. The second one is about the study design, and then this last one is about the analysis and findings. So just a couple of final thoughts. Qualitative research is difficult and sometimes frustrating, but it's rewarding. It feels like it's, if not for this work, sometimes you feel like those voices may not get heard, or that perspective may not be shared with the people that are writing policy or the people that are designing programs. And so it's helpful to get that information out. I've also found qualitative research experts, they don't like to be put in a box. They don't like a specific formula, but then they also usually have strong opinions about how to do things. And so it's important, again, stay humble and be open to input. And as you come across people that have strong opinions about qualitative things, for example, you shouldn't be counting codes, or you shouldn't be doing this, the other important things. Listen to what it is they're saying so that you can understand that better, and maybe be able to respond to it, or at least keep it in mind as you think about things. Be deliberate about selecting and following an analysis method. Again, grounded theory, you'll want the grounded analysis piece to match that theoretical approach. So don't take shortcuts and just say, I'll just start coding and it'll be fine, but actually put some thought into that. If you're wanting to do a qualitative research study, especially the first time, read several published studies, even if they're on different topics, and look at how they've described methods, how they presented their data. That's a very helpful way to kind of see how it's been done successfully. And then find a mentor. I found that very helpful. I didn't think I would need it, but it came in very handy, especially the first time I did that. And then lastly, keep an open mind about what you discover. Sometimes you'll be surprised. And in fact, most times you'll be surprised by what you find your participants saying, and you had never read it in the literature before. And to me, that's exciting, to be able to identify new information, new knowledge that hasn't been established before. To me, that's the exciting part about research. All right, I'm at the end of my time, but maybe we could take a couple of questions in the chat if needed, and if you've got any questions, and then otherwise I'll turn it back over to Brian.
Yeah, thank you, Jennifer. So if we have questions, please, we can invite some questions, some feedback. I think you can type the question, or you can raise your Zoom hand and we can spot you and you can go ahead with the question. So we can start right now.
I like that, a Zoom hand.
Yes. So I think we can start with Bridget, and I must also say that we'll have fewer questions in the interest of time, but we can start with Bridget in the meantime and see how it goes. Bridget, please.
Yeah, thank you very much. And thank you for that very educative presentation. I just have one quick question on the coding. For instance, the one about hope. One of them was about someone was being very hopeful, and then I think it was the psychologist who was very like displaying a lack of hope, but they were coded the same way. So I was thinking, like, don't you lose something there? Because if I read that, I would think that they were both very hopeful. Or is it possible to break that into hope and lack of hope? Or I don't know. But can you just comment on that? Thank you.
Yeah, no, that's good. So sometimes with coding, you'll want to, and depending on how you want to present your data, you may have your exemplar for your code and say this quote really, and again, that's that toward the end of the steps with thematic analysis for how you describe your themes. And so identifying your exemplars, and you'll have a positive exemplar. And so the one that, I think about hope from one of the quotes from the pastor might be the example one. You say, this is kind of the exact quote that matches what this means. And then sometimes you'll have a negative exemplar or sort of the opposite of, and you'll say, and here's someone that described the lack of hope. And this would be your quote. So that's one way of thinking about it. So when you're describing your theme, you've got the positive and the negative, or the exact exemplar and then the opposite example within that same quote. But I also agree with you that sometimes something is so different and it's the opposite that we should give it a separate code. And in this particular case, I agree with you. I think it would probably be better to have the opposite of whatever, or give it a different code and still put that in with either difficulties or outcomes, depending on where we think it fits best. But what I think is kind of exciting or neat about qualitative research is there's not one exact answer. Like there is with math, there's either a right or wrong answer. And in this case, it's not a right or wrong code. It's how do you describe it and how do you pull meaning from it. And so I think that's an important thing to talk through with your study team. So the same idea, regardless of what code you put out, you give it, that same concept or idea comes through how you've described the experience of that. But thanks, Bridget, for the question.
Okay, so I don't know if we have any more questions apart from the question asked by Bridget. Please.
Yeah, I see a new one in the chat. That's a really good question that I didn't speak to about mixed methods. And so I think that's excellent. There's a good book about mixed methods. I think it's Cresswell, but I'll double check. But there are a lot of ways where you incorporate qualitative into a mixed method study. And the neat thing is it depends on what you need or what you're studying or what you know already. And so it just depends how you want to design it, about where it fits. And that then determines how you present your results. Personally, so I have seen mixed method studies where they reported their quantitative results separate, and then they published their qualitative results separately. And I would say that's sort of the antithesis, or that's the opposite of what the intention of mixed methods, because the intent of mixed methods is not to do both. The intent of the mixed methods is what did you learn from doing them together. And so even if sometimes there's limitations on how much you can put in a manuscript, and so you may want to publish quantitative to give it its due diligence, and so you may want to publish that separate, and you may want to publish qualitative separate, but do not forget to publish the synthesis of the two. And then that book, I'll put it in the chat as soon as I find it, that being able to present both together. And it's okay to say, here's a short summary of the qualitative, here's a short summary of what we found. For example, these might be the demographics and the survey results, with specific percentages of responses. And then here's our themes and codes that we found on the same topic. And here's what that means when we pull it together. And so I think that's an important element of mixed methods. I am a big fan of mixed methods when it's appropriate. Sometimes it feels like you're just doing, you're pretending one or the other, like it was really intended to be quantitative, but you just called it mixed methods because you did something extra to make it seem better. But if you don't do both well, then it sometimes kind of undermines your work. But thanks for that question. That's great. Okay, Brian, I think over to you.
Thank you, Jennifer. Thank you for that presentation. And thank you, everyone. And thank you for the contributions and for your attendance. And our next presentation will cover aspects of theoretical and conceptual frameworks. Just wait for Jen to stop sharing the PowerPoint. Thank you.
Sorry about that.
No, it's all right. It's okay. Thank you, everyone, and hope everyone is able to get me. So we are going to cover theoretical and conceptual frameworks. And I must say that they are a mandatory ingredient when you're talking about research. And I think before we go into the details of what we want to cover, I want to establish the premise in terms of how we go discussing theoretical as well as conceptual frameworks. So I want to say that conceptual frameworks are products of qualitative processes of theorization. And therefore, it would mean that to explore the process of building conceptual framework, one needs to define the terms, concept, as well as conceptual framework, and then also outline the process as well as the procedures of conceptual framework building. So a conceptual framework also provides not knowledge of hard facts, but knowledge of soft interpretations of the intention of the research. On the other hand, a theoretical framework strengthens the research work in many ways, including when you want to make an explicit statement of the assumptions that you want to write on as you do your study. And the theoretical framework connects the research to the existing knowledge. And having a theory as well as a theoretical framework identify the limits to the generalization that one needs to carry out in their study. And a theoretical framework specifies which key variables influence a phenomena that is being studied or the phenomena of interest. But it also highlights the need to examine how those key variables might differ and under what circumstances. So these are the premises that we want to use to look at conceptual and theoretical framework. But the question is, why do we need a theoretical framework? So there is need to make the theoretical framework very explicit. And making it explicit is important so that the readers use your eyes to understand your work. But it's also necessary because it will help you to be understood much better as you carry your research. So this is very important because you don't want the readers to impose their own eyes on your work. You want them to understand you through the eyes that you've used in your work. So when you do this, it's also important that you ensure that there's a theoretical consistency throughout your work. So there's a tendency that at some stage you say, this is my theoretical framework or conceptual framework. We only see it once in a particular section. And when you present, for example, your results, or when you discuss your results, we don't see the theory and the concepts that you have built earlier on. So this is the point, is speaking to this very idea that it's important that you ensure that there's a theoretical consistency throughout your work. There are also questions of whether you can use more than one theory. Yes, you can use more than one theory, more especially if you have theories that are at loggerheads. So readers need to know, for example, why you are going to use many theories or multiple theories, and why using just one theory is not enough. But then why do we want to have a theoretical framework? In essence, we are saying, what is the aim of a theoretical framework? So the aim of the theoretical framework is to identify the key concepts in your research questions. Explain the key concepts by doing a thorough literature review, and you see how researchers explain these key concepts. And you later on want to link the key concepts with the literature. So it's important to have questions at the back of your mind when you are developing the theoretical framework. Questions such as, will you be testing a theory? Will you be contributing new evidence by collecting data? So using theory as a basis to understand your results is what you'll be doing maybe. Or do you want to challenge the theory? Or do you want to use the theory in a new or in a novel way? So it's important that you do this bearing in mind that you want to draw up a hypothesis in research. So every time you hear the word theoretical framework, you are thinking of the eyes that you want to use, and you want to ensure that the readers of your work should use the same eyes that you used, so that you are not misunderstood. So what are the common questions that we are faced with when we are talking about theoretical and conceptual framework? Are questions like, can you use more than one theory? A question that we've addressed somehow. And the other question is, why do it? And what is the aim? And we've tried to highlight some of the aims with respect to that question. And we've already said that you can use more than one theory, especially if your theories are at loggerheads. But you need to tell your readers why there is need for you to use multiple theories and why one is not enough. Often, and especially students tend to ask the question of, are there differences between theoretical and conceptual framework? And knowing that there are differences is very important, because sometimes people present the theoretical framework as a conceptual framework and vice versa. So theoretical and conceptual frameworks guide the paths of the research, at least that's what they are there for. And they offer the foundation for establishing the credibility of the research. So though these terms seem similar, they are different from each other in concept, as well as in the roles in the research inquiry process. Many students, as well as scholars, find it very difficult and sometimes confusing to distinguish between theoretical and conceptual framework. The purpose of a conceptual framework is like a roadmap for your study, which is going to help you visualize your research project and put into action the very ideas or the concepts that are, or ideas that are interlinked. It defines the relevant variables for your study, and it also maps out how they might relate to each other. So conceptual frameworks have different uses in different types of studies. In quantitative studies, a conceptual framework might be used to determine survey questions or data points, or sometimes to generate hypotheses for explanations as well as for predictions. In qualitative studies, a conceptual framework might be used to provide a working hypothesis or a set of research questions, or sometimes to identify or to explore categories in descriptive research. So theoretical framework is a structure that guides research, and theoretical framework is informed by different theories. So more to say that when you're doing a study, you are coming with assumption in that particular study. And a combination of theories guide your own research. There's a question of, should master's students and PhD students have a theoretical framework? And I want to say that at a PhD level, you can critique the theory because your data is telling you something. At PhD level, you can also engage with the theory. So at PhD level, you really need to engage the theory because the PhD is really about theorizing. So as we've already established, conceptual frameworks are interrelated concepts or ideas that explain the phenomena. So you need this in your study. And we've already established that theoretical framework are underlying theoretical approaches that are informed by different theories that are already written, and a critical review of these theories when you are doing your master's and your PhD is very relevant. So in a master's research, there might be one or two theoretical frameworks. For a PhD, which warrants original research that provides a substantial contribution of new knowledge, 3 or more theoretical frameworks might be involved. There are, of course, some wrong notions when it comes to theoretical framework. For example, very often we see students lift maybe some existing concept, maybe the theory of change. And I want to say that those things that we lift are not theoretical frameworks. So for example, the theory of change is not a theoretical framework. What would be the theoretical framework in this case is the very theory you will need to explain that there's change is actually what a theoretical framework will be. So maybe we can look at a few steps in terms of, in a practical aspect, how we can create a theoretical framework. So we need to start by definition of terms, and later on explanation of theories, and end with the logical connections. So the first thing that you want to do is to define your objective. So this is the first step in creating a theoretical framework. You want to define your research objective, and you want to gather supporting documents. So consider what you hope to achieve with your study and what new information you aim to bring to the phenomena that you want to study. Number two, you want to write down a statement of the problem or the problem statement. So once you define your objectives, you can write a problem statement. You define the purpose of a study and what problems it's addressing. So for example, if your research, let's say you are researching on the moons of Mars, you might create a problem statement like, for example, Mars has 2 moons, but maybe you can say, I have observed another astral body, which may be a 3rd moon. Number 3, you want to present your research questions. So a research question is an inquiry that you aim to address with your study results. And these questions often provide a basis for theories or for hypotheses. And they can help your audience understand the study's purpose and the information you are seeking. So this can clarify to your audience whether your study was successful. So a researcher studying Mars moons might ask the following questions. For example, how can I prove the astral body I'm observing is another moon? Or what tools can I use to verify my findings? What qualities am I looking for to verify the object? What factors affect objects' behavior in space? Why has no one else observed the object until now? So if you plan to answer more than one questions with your study, consider adding a section of subsections to support your main research questions. Number 4, and this is very important, is you want to create a literature review to highlight relevant theories. So literature review is simply a summary or analysis of all the research that you read before doing your own research. It collects key sources on a topic and outlines how these sources and other researchers' theories align with your study and how you are using the research to develop your theories. So since some research, for example, requires several theories from many studies, it's very helpful to define why each theory applies to your research in your theoretical framework. So for example, if you are studying the very example that we've given, Mars moons, you might evaluate research from astronomers, from astrophysicists, or other scientists to determine whether their work supports or denies the existence of another Mars moon. So in essence and in a practical way, for example, in the example that we've given, the objective would be, the objective of this study is to disapprove astronomer Asaph Hall's 1877 theory that Mars has only 2 moons orbiting it. The problem would be many astronomers observe 2 moons orbiting Mars and disregard a 3rd astral body. So the research question would be, why does the 3rd astral body orbiting Mars qualify as a moon? And the sub-questions would be, why do we have astronomers, or why have astronomers ignored the 3rd astral body up to this point? And what behaviors of the astral body indicate its orbit? In terms of the literature, you may say, for example, Hall theorized that since Mars moons were small and more similar to asteroids than Earth's moons, they may have formed from a planetary ring millions of years ago, and so on and so forth. But in concept, this is a framework that you want to use to develop your theoretical framework. So ideally, what you are doing when you're developing one is that, and there's an interlink between conceptual and theoretical framework. You are conceptualizing a topic. And when you do this, you are reading so much of the literature so that when you formulate your mind, it is governed by empirical evidence. And that will, in a lot of ways, help you to identify the statement of a problem, but also because you repeatedly be reviewing the literature, it also helps you refine that statement of a problem and you can derive your research questions. So it is very important to develop these frameworks in the early stages of your study to guide your thinking and enable you to visualize linkages between various concepts and theories. So both frameworks are the lifeline and the bedrock of research. And without both, research findings becomes very weak and they lack direction. A theoretical framework remains the brain of the research, but mostly it is ignored and mostly it is also misunderstood both by researchers and students. So it's very beneficial, and it will be very beneficial that you have one when you are conducting a study. And remember that the goal of a theoretical framework is to connect your new research to existing knowledge and provide an explicit statement of theoretical assumptions to the reader. It helps you to lay the foundation that will support your analysis and help you to interpret your results and make broader generalizations. And furthermore, a theoretical framework can also help you to organize complex scientific documents into readable formats. And by using a theoretical framework, you can coordinate your ideas with supporting research, which can help other researchers understand as well as apply your ideas in future research. So both the conceptual and theoretical framework should be a must in your study. And this ends the presentation, and I can invite feedback, questions, and any other contributions. Are there any questions?
Brian, I do believe there's a couple things that popped up in the chat.
Okay, so I don't know where to start from. Okay, so is it recommendable to use both a conceptual and theoretical framework in a study? So I can start with that one. Yes, exactly, because a conceptual framework is you linking the ideas or linking the concepts or different explanation to the phenomena. So you definitely need both. The theoretical framework is simply the assumptions that you bring to the study. So you can't carry out a study without any assumptions. And you have these assumptions because there's a lot of empirical evidence or a basis for us to begin to discuss a particular idea or to begin to inquire about a particular idea. There's a whole entire body of empirical evidence that governs our thoughts. But you can almost definitely tell that you can actually derive a conceptual framework from your theoretical framework. So you actually need both the conceptual and the theoretical framework. Another one is it possible to use a theory that has been criticized by several authors? Yes, it is very possible. And I think this will happen especially when, for example, it's a PhD student or an accomplished scholar. So you can actually engage the theory For example, you could have a theory that has been criticized. And I think when we said you engage the theory, so you can actually engage the theory by understanding what sort of assumptions were used and why, for example, you think the assumptions that were used to formulate a particular theoretical framework do not hold any longer, or why maybe there's a lot of criticism around a particular thinking. And definitely you can do this. And actually, this is what you would want if you have a PhD student. This is what you would want them to do, is that they can engage the theory. They can also critique the theory. And I think for this question, the critique part of the theory would apply. Another one is, under what circumstances does one need to use both conceptual framework and theoretical framework? So this is very much related to the first question, which is asking whether we can use both conceptual and theoretical framework. So the answer to this question is that it should be mandatory that both conceptual and theoretical frameworks are used. They are different ideas. They are different in concept, and the differences are that conceptual framework are interlinked ideas. So for example, you can have one idea that explains how you are getting to something, and another idea from another work that explains how you get to this. And once you link these ideas and you have a flow of understanding these different explanations, then it makes you maybe understand the concept of what you are doing in a much broader way. The theoretical framework, and I think I will keep on repeating this, are simply the assumptions. You want to come with assumptions when you do the study. So both should be used in a study. And it's not like when you use a theoretical framework, maybe you should not use the conceptual framework and vice versa. The next one is there a relationship between conceptual framework and theoretical framework? Yes, there is. Or should there be a relationship between theoretical framework and conceptual framework being used? So once you've established actually your theoretical framework, you can actually, from your theoretical framework, so the theoretical framework becomes like the mother, where you can have something be birthed from, and that would be a conceptual framework. So if you like, the theoretical framework is a bigger a spectrum of ideas or assumptions around the phenomena. And from there, we can begin to narrow down into what are the ideas from different assumptions. And those would be the differences. Should all studies have conceptual framework? I think that's a question that has been asked. And I think the idea of this presentation was to relay a message that all studies should have conceptual framework and they should have theoretical framework. So actually there's a claim, people make a claim like there is no conceptual framework or there is no theoretical framework. So even when you do not say that you have a conceptual framework and a theoretical framework, the truth is that you have one. And there's a danger when we know that you have one, that you've not made it explicit. So that's why it's important that you don't assume that, we don't make your readers assume that it's there, because they know that it should always be there. But once they make an assumption that it is there, so these are moments where you have, for example, when you're doing a presentation, one person in the audience says, if you added a particular element to your study, it would be very nice. And you feel like it's a very brilliant idea. And another person say, when you're doing the presentation on another day, like if you did this and removed that, maybe that would be a very nice idea. And very often you are very confused with why did it sound very nice when one person contributed? It still sounded very fundamental idea that should be included to your study when another person made a comment. So this is because you've not made your conceptual and theoretical framework explicit. So making it explicit is simply saying that these are my eyes. I use these eyes to see these ideas or concepts, interlinked ideas in my work, and I come with these assumptions. And once you make it explicit, what you are merely doing is that you are telling your audience, I want you to see everything using this lens. And you want to ensure that there is a consistency. So don't just present these ideas, for example, in the literature review, and when you present your results and your discussion, you would have forgotten that you are using this particular lens. So be consistent when you make them explicit. So I think the next one is it always that the conceptual framework should show the relationship between variables, or it can merely show that what variables you need to use in your study, and it can be a diagram? So I think making a diagram out of a conceptual framework is a very idea of making it explicit. And that's what you typically want to do. And that's what most researchers want to do, because once you put your ideas in a diagram, it becomes very clear, becomes very concise that this is exactly what you mean. You don't want to be misunderstood when you say, these are my eyes. So putting up a diagram with a bit of some narrations on the diagram that you are using to demonstrate that this is my conceptual framework or this is my theoretical framework makes it explicit, and you ensure that no one is going to misunderstand you. Okay, so I think maybe to try to also, yes, Jennifer, I think we have a hand from Jennifer before I go into what I wanted to
No, yeah, no, I can't resist. That was a really good presentation, and sometimes it's a good reminder of why, regardless of what type of study that you're doing, you have to base it on all of the knowledge that's come before us. And we can't pretend like we're the only ones that have thought about this idea. And so I think it's good to build on the shoulders of giants, is one way to say it. And it's often very helpful and quantitative, because then we can, we don't forget an important variable, or we make sure to look at each variable. But in qualitative, it can also be helpful. It can help guide the questions that you want to ask your participants, but don't stay, what I've discovered firsthand is don't stay in that mindset when you're coding or analyzing your data. And that's slightly different with qualitative. So it helps guide our questions, make sure we're asking about those things, but then we stay open to what it is that people are telling us about their experience. And in some cases, their experience doesn't match the theory. And that's helpful to be able to describe with that. But you can't pretend that that theory isn't out there, because like you say, you've used something to decide what you're going to talk about or ask about or measure. And so that's your theoretical model, and it's important to make sure that's based on something. So, but that's great, Brian. Thanks.
Thank you so much. Thank you for that contribution, Jennifer. I don't know if we have any more questions. Maybe a bit of an illustration, maybe in a practical way, I can invite Bridget to say something, and how maybe in the use of maybe an example of a theory around gender, maybe she can give an example in terms of how that can be applicable. Bridget, are you available for that contribution?
I was just trying to think about, maybe for like gender, we tend to think about gender roles. So we say that maybe what we do it's either productive roles or reproductive roles or community service. So if you're women, then you find that, at least in our setting, women tend to be more involved with reproductive roles. So this is the home care, looking after kids, and keeping the home clean, and getting domestic water, and things like that. So there are a lot of theories around that. Why is it like this? Then there are gender relations. So the man is the head of the household and the woman has to be submissive. And this feeds into everything else that we do. So for instance, if you're looking at gender in agriculture, then you can already predict from the theory that there are certain things that the men will be doing, there are certain things that the women will be doing. So that is the theory that informs you even before you go to collect your data on maybe how agriculture is done in a particular area. So then when you decide what you're going to focus on, then you'll be looking at specific issues. So for instance, how does this particular variable I'm interested in affect the other one in this kind of setting? So I may have something very simple, simplified from the big theory for my particular study area. That's how I tend to think about it. Yeah, thank you.
Thank you, Bridget. A very actually practical illustration. And there would be, yeah, so actually from the example that Bridget gives, there would be different lines of thinking, and also different maybe ontological positions when it comes to maybe what would be the perspective around the gender roles, because there would be different settings where the role of a man, for example, is defined very different from this setting compared to another setting, and so on and so forth. So there are all these explanations around the gender roles. And you recall that during the presentation, use the word like assumptions that you bring into the study. So readers want to know, like, are you using the assumption of the gender roles maybe as from the African setting, or as from the European setting, or as from another setting? So when we say theoretical framework assumptions that you bring to the study, that's what it actually means, because they are different explanations. Now, if you don't make this explicit, what it means is that, for example, if the reader of your work is from Europe and you've used a theory that explains gender roles from Africa, then it becomes very difficult for them to understand and contextualize what you really mean when you say certain things. But if you make it explicit and you say the gender roles are being looked at using maybe this lens, and it's the lens from this particular setting, so then what you are doing is you want to narrow the and maybe focus the eyes of your readers to these particular assumptions. It could be maybe 2 assumptions that you bring to the study. And when we talk about you can have more than 2 theoretical framework, we simply mean like you can have 2, 3, 4 things that really explain the idea that you are looking at, but the readers want to know exactly what is common. And I want to repeat on this very consistent way of doing things is that people present they make it a formality when they present a conceptual and theoretical framework that this is what I'll use, but when it comes to the results of your study and the discussion, then we have no theoretical consistency. And when people would have read your concept and your theoretical framework and you don't make it explicit throughout your work, then they begin to postulate, they begin to develop different ways of explaining or understanding what you've presented in your results, as well as in your discussion, the way you've discussed. So don't leave room for readers to begin to misunderstand you because you've not made your conceptual and theoretical framework explicit. So I thought I should say thank you, Bridget, for bringing up that idea, because really it contextualizes the idea that we should have assumptions, and they are different ontological positions to phenomena that we study and ideas that we bring into the studies that we are doing, or the research that we are doing. And thank you so much for that. So I don't know if there are any more questions, and if we do not have any more questions, this would mean that we've come to the end of the webinar. And I just want to say that we'll be carrying out a lot of webinars.
Sorry, Doc, before you close, there's one from Purified. He's
Yes.
asking how you determine what theory to use in your research. Like when you start out, how do you know, for instance, since you've said that the theoretical framework is probably derived from the theories in your field, like how do you know which one to use? I hope I've captured his meaning, something like that. Thank you.
Yeah, so there isn't a specific response to what specific theories you should bring into your study. But I think when you immerse yourself into the literature or into the body of empirical evidence, what you are doing is that you are using your critical mind to look at different explanations and whether these explanations make sense. And I think in science, we tend to use the word consensus. So you will find that when you pick on assumptions, sometimes you will know that there's a lot of consensus around a particular assumption that you are picking. But also you will know that when you pick on a particular assumption, for example, maybe you have loggerheads explanations around the phenomena, and you are not going into the literature to pick this idea, but you are going into the literature with a critical mind, a very pragmatic mind, where you say, first establish, has this been established in terms of consensus, and what is the consistency of the idea? Has it been researched and replicated many times? For example, has it been transferred to different settings, replicated, and so on? So you are doing this and being governed by the tenets of science, and really not merely picking the idea because you want to use it as an assumption. You also want to pick these assumptions, knowing very well that there would be questions in terms of why do you think this is the best way of explaining this idea and compared to the other one. So you actually want to know, when you pick on this particular one and you say this is the assumption that I bring, you actually want to know that there is this explanation, there is also this explanation. You actually want to highlight in the very theoretical framework that there are different ways of explaining this, and these maybe stand out more than the others because maybe there is consistency, maybe there is consensus, and so on. So not merely that you pick on one idea because you just want to pick on it. So it's a critical mind that guides you throughout the process of which assumptions you are bringing to the idea. And when you bring those assumptions, you really want to critique them, you really want to engage them, you really want to do a lot of other things that we do with theories. So you want to know what are the reasons why I'm picking on these assumptions and what do I hope to achieve. Yeah, so I think if there are no any other comments, and I was saying that we will continue having a lot of webinars, and we'll announce when we will have the next webinar and on which topics, and we'll circulate in the same way we circulated. So we want to say thank you to everyone that attended. I think we have an attendance that reached maybe up to 95 people at some point. And I think from different countries, I see people from South Africa, Namibia, USA, I see people from Zambia, and thank you so much. And please look forward to the next presentation. And we've come to the end. Thank you. Thank you, Jennifer, for the presentation. I don't know if you have any words before we close.
No, this was wonderful. Brian, what a great thing to begin. And I just enjoyed being part of it. And thanks for the great questions.
Thank you. And thank you, Rod, for making this possible using technology. And we'll be relying on you in terms of a lot of people asking how this will be shared and the like. I don't know, maybe you can say something around that.
Yes, God willing, I will be sharing this on the YouTube channel, the Meros Center. And I think we can get the emails from the links here, and we'll make sure to publicize that as well. Otherwise, keep a look at that channel, and we'll have this summary posted there. Thank you very much.
Thank you. I don't know if I have my HOD here. Mr. Shula, are you around? And you can say a few words and close the webinar.
Thank you so much, Dr. Chuluban. Good afternoon, everyone. These have been very, very wonderful presentations. And we are really looking forward to many, many more. Those are my very few words, and thank you so much.
Thank you, everyone. Until next time. Bye.